Urinary tract infection by Christina Lau. Overview. So what is a urinary tract infection? A urinary tract infection, or a UTI, is an infection on any part of the urinary system tract. UTIs are caused by bacteria which originates from the anus, which travels to the urethra, causing an infection. If left untreated, it's important to note that this infection can also travel to the bladder and even the kidneys. It is primarily caused by strains of Escherichia coli, or E. coli, but is also known to be caused by other bacterial species as well. Different types of UTIs. As expected, there are many different types of UTIs, but they all differ in terms of their origin. Many of them occur in the lower urinary tract, but they can also include the upper tract as well. There are 3 different types of them, first of which is urethritis. This refers to an infection/inflammation in the urethra and the ureters. Our second type is cystitis. This is an infection/inflammation in the bladder. And our final type is pyelonephritis, which is an infection and inflammation in the kidneys and the renal pelvis. If you look at our picture on the right over here, note that pyelonephritis occurs in the upper tract and urethritis and cystitis occur in the lower tract. Risk factors. About 1 in 5 women may experience a recurring infection, and this is usually caused by a different bacterial strain, or it could be caused by the same type of strain which caused the first incidence of a UTI, but this strain has become antibiotic resistant. Risk factors may include being female. Generally speaking, women are at a higher risk of UTIs compared to men because anatomically their urethras are shorter, which decreases the distance that the bacteria have to travel to access the urethra. As a result, bladder and kidney infections can occur much faster than they can with a man. Additionally, having genetic predispositions or abnormalities in the urinary tract can also increase your risk of having a UTI. Also, having an enlarged prostate, being sexually active or pregnant, having kidney stones, menopause, or diabetes can also increase your risk of contracting a UTI. It is important to note that when you have menopause, this decreases the levels of vaginal lactobacilli, or the good bacteria, which help protect you from infection. And additionally, with diabetes, people may have a compromised immune system, which means that you're going to be less likely to be able to fight off infections like UTIs. Signs and symptoms. There are many different signs and symptoms of a UTI, but they may include but are not limited to the following: a feeling of pain or pressure in your back or your lower abdomen, a fever or chills, having cloudy, dark urine with an odd pungent smell, a frequent urge to urinate or polyuria, having a burning sensation when you urinate or dysuria, urinating frequently during the night or nocturia, or having the presence of blood in your urine or hematuria. Diagnosis and treatment. Typically, when diagnosing a UTI, a urinalysis may be performed. This is a test in which the composition of urine is analyzed. If white blood cells or red blood cells are present, this may indicate a UTI. Urine cultures are also conducted in order to determine whether or not the urine sample contains a UTI-causing bacteria. A doctor may prescribe antibiotics or painkillers to treat a UTI. Urinary tract antibacterials and antiseptics are common as well. Antiseptics inhibit the growth of bacteria. Be sure to finish off your medication even after you recover in order to ensure that your body is purged of the infection, and drink lots of water to help flush out the bacteria. Prevention. Be sure to void your bladder when you feel the need to urinate, and be sure to wipe from front to back. Have good hygiene and try to wear proper clothing. Be sure to wear cotton underwear and loose-fitting clothes. When wearing tight clothes, this can trap moisture, which creates an ideal environment for bacteria to grow. That's all, folks.